Hey, it's Dr. Centeno, and I'm the Chief Medical Officer for Regenexx, and I'd like to walk you through how the Regenexx Interventional Orthopedics approach and evidence base really stacks up against surgical orthopedics. So these are the grades of evidence that we'll be using for this presentation. There are a few of these published. I've just added A, B, C, D, E, F here to give you a sense and to make it a little bit more like the grades that you would get in school, so you have an intuitive sense that A is better than F. So let's first look at how Regenexx grades out with high-dose bone marrow concentrate with regard to the research we've published to date. High-dose bone marrow concentrate is a same-day stem cell procedure. So we get an A for our randomized controlled trial that was recently published. It's approximately 50 patients and a crossover with physical therapy, showing efficacy for our high-dose bone marrow concentrate in knee osteoarthritis. We get a B for our 840 procedure case series, comparing the efficacy of bone marrow concentrate versus bone marrow concentrate with a fat graft. We get a C for our 373 patient case series where dose versus response was determined, and here we actually looked at and figured out that we needed a minimum dose of 400 million total nucleated cells per knee to get the best results. We get an A for our ACL randomized controlled trial. We're going to be publishing the first 40 patients in this trial here within the next few months. And excellent preliminary results are shown thus far, and those are in the abstract section of this presentation. We get a D for 2 single-site MRI before and after cases with pain functional outcome with partial to complete ACL tears. So these are case series that we've published. We get a C for a case series of 102 patients with outcome collected from multiple sites who had shoulder OA and shoulder rotator cuff tears. And we get an A for our randomized controlled trial, which is again upcoming. We should be publishing the first portion of this here pretty soon. And this is for partial to complete rotator cuff tears. A C for a case series of 196 patients with hip OA. A C for a case series of 470 patients treated with lumbar radiculopathy who had platelet lysate epidurals versus high-dose corticosteroid epidurals. A C for our multi-site all complications safety paper. This is actually the largest safety paper published to date by anyone in orthopedic stem cell use. Safety in more than 3,000 procedures over 9 years and multiple body areas treated. So we use a lot of platelet-rich plasma at Regenexx as part of our interventional orthopedics approach. Our goal with platelet-rich plasma is many times to use a less expensive alternative to bone marrow concentrate. And at the end of the day, here at our Colorado headquarters, we use about 4 times as much PRP as we use bone marrow concentrate because it's less expensive for patients. So if we look at just what others have published in this area for PRP, the use of PRP in mild to moderate knee osteoarthritis gets an A. The use of PRP for elbow epicondylitis or tennis elbow gets an A. And the use of PRP to treat shoulder rotator cuff injuries without surgery gets an A. So orthopedic surgery grades. How does orthopedic surgery stack up against all this research? The answer is not well. If we look at one of the most common orthopedic surgical procedures done right now, which is arthroscopic debridement in patients with knee osteoarthritis, this gets an F. Basically, we have large randomized controlled trials that this does not work versus a sham procedure. despite the fact that many insurers are still paying for it. How about meniscectomy? Probably the most common orthopedic surgery on an elective basis performed in the United States today. This gets an F based on 3 large randomized controlled trials showing no efficacy versus physical therapy or sham, and you can bet that you're paying for lots and lots and lots of this stuff right now. How about knee replacement? This is interesting. It either gets an A or an F depending on how you look at this one study. We only have, believe it or not, one randomized controlled trial showing that this works, but the efficacy was really poor. The number to treat, or the NTT, for a 15% functional improvement was 5 to 6, and 3 in 4 patients at 1 year canceled their knee replacement due to the results of physical therapy alone. So A, for the fact that a randomized controlled trial after 30 or 40 years has finally been done, an F for the fact that the results from the randomized controlled trial were not all that great. So how about ACL reconstruction for an ACL tear? This is one of the most common sports medicine surgeries performed today. And I put F question mark because at the end of the day, a meta-analysis couldn't conclude based on high-level evidence that surgical outcomes were better than conservative outcomes, meaning there was only low-quality evidence that supported most of the metrics in the study. Shoulder rotator cuff repair with decompression, extremely common procedure. Obviously, you're paying for a lot of this day in, day out. An F, a meta-analysis of 5 randomized controlled trials indicated no benefit from decompression, and the relationship to structural acromion type and outcome was not confirmed, meaning that we have been for years and years lopping off large pieces of the acromion because we believed that there was some relationship between that acromion type, a hooked acromion. We even came up with types for these acromions, and at the end of the day, it didn't pan out from a research standpoint. F for rotator cuff repair for full thickness tear. Again, extremely common surgery. You're paying for a lot of these. A meta-analysis of 57 randomized controlled trials indicated no difference between surgical repair and conservatively treated rotator cuffs. An F for lumbar fusion with degenerative disc disease. Now, again, a hugely popular low back surgery. This has become one of the most popular back surgeries in the United States and one of the most expensive elective orthopedic surgeries out there. And you're paying for a lot of these, but a meta-analysis on 5 randomized controlled trials showed fusion was no better than conservative care, but fusion had a 10 to 24% complication rate. So these are some of the supporting documents, abstracts of studies. I'm just going to go through these very, very quickly. So thanks for watching. My goal there at the last part was just to give you the ability to copy and paste or take screenshots of any study abstract you wanted to see. But again, in conclusion, as you can see, Regenexx and our interventional orthopedics approach stands up very nicely to orthopedic surgery. And in fact, right now, orthopedic surgery is undergoing basically an implosion of its evidence base, meaning that most of the orthopedic surgeries you're paying for, we know don't work. So have a great day.